This presentation, I'm going to quickly go through the process that we went through in developing the front of pack labelling system, the health star rating system that some of you will have heard about in the media in recent times. I'm not going to talk at all about the algorithm, mainly because I don't understand it, but I'm assured it works very well. This is an algorithm for allocating stars to foods. And I'm not going to talk about the research that has been done with consumers to test the veracity of it. I will show you some how various food, generically de-identified foods products actually perform against the star rating, and I will also highlight the key elements of the graphic, and I'll highlight the next steps and some gaps and opportunities for the future. I assume it's that one. Yes. So the whole debate about the front of pack labelling system started probably about 2004-2005 during the time when the Brits were just bringing in the traffic light system, but it really wasn't until the Buckett review on food labelling, labelling logic was completed in 2011, where Buckett and the team that worked with him made some specific recommendations about having a front of pack labelling system. And that really developed the will, that there was enough will now for negotiations to start. Up until that point, really the views were polarised and very contentious. Not that it isn't particularly contentious at the moment. So what happened after Buckett? The Buckett's recommendations, most of them were accepted by government, and they agreed to work on a FoPL system, and also give directions on how what that system was supposed to do, and that's shown on this slide. So the central element is to provide convenient, relevant, and readily understood nutrition information and/or guidance on food packs to assist consumers to make informed food purchases. The major features of it were that it should enable direct comparison between foods. It needed to be readily understandable and meaningful across socio-economic groups, taking into account literacy and so on. And the focus was on processed and packaged foods at retail level. This is a very contentious area, food regulation. It's overseen nationally by the Legislative Governance Forum on Food Regulation, the Ministerial Forum, we'll call that. This group is responsible for setting national food regulatory policy as well as setting standards. And one of the reasons that it's so contentious is that each of the states and territories have given up their sovereign rights for the sake of this national process so that there is consistency from one state to the next when it comes to food standards. The forum agreed to the process, and it set up a steering committee which was made up of a member from each of the jurisdictions that were on the standing committee that supports the Ministerial Council, plus a member of the Australian Health Ministers Advisory Council. This was to make sure there was a continuing very strong link with health ministers, because it's the preventative health agenda of health ministers that makes this such an important issue. The steering committee in turn established a project committee that was represented by industry, by key stakeholders representing of industry, public health groups, consumer organisations, as well as government, including regulators and health. Now, I'm not going to talk too much. There were two groups established underneath the project committee, a technical design working group and the implementation working group. I'm not going to talk about the implementation group very much, just to say that it, through its deliberations over several months, year or two, determined that the system should be voluntary, should be picked up by industry on a voluntary basis. It needed a shared governance approach, and it also needed to be supported by an effective government-led education and social marketing campaign so that people knew what the whole system meant. I'll focus on the technical design group and on the design and application of the system. This is very busy. What you need to know from this is that we looked at a number of systems available around the world and some ones under development against some criteria based pretty much on what the you can't obviously read that. The criteria are down the side, based on the instructions that the Ministerial Forum had given us. And through that process, we really quite well established, I think, that a star system was likely to give us the best opportunities because it was going to be interpretive. It would interpret complex information for consumers. It would be available in a monochrome format as well as in colour. It particularly avoided the use of the traffic light system, which was anathema to many parts of industry. And it was it's a system, a star rating system, is easily recognisable because it's what guides us through movies, through white goods and so on. How to develop a system that could measure food, the quality of processed and packaged food, was difficult. Again, this is a busy slide, and the main points to bring out of this is that one of the aims of a FoPL system is to support the Australian Guide to Healthy Eating and systems really that encourage people to eat a healthy and balanced diet. And we, in the early stages, a technical design working group looked at using the food groups as represented in the Guide to Healthy Eating, but it's quite difficult. And industry has more groups as well, it breaks it down even further. The issue is that many processed and packaged foods don't present food in those particular forms. You've got to think Hawaiian pizza, which actually has something from all of the elements in the dietary guidelines there. There was, however, in development, that had been developed, the nutrition profiling score criteria that were being used, that was being developed for health claims that were also going through the system. And this had a fairly simple way of breaking foods into groups representing general foods, beverages and fats and oils, and awarded points accordingly. And that's what we decided to base the system on. And I'm going to cut right through the middle of all of the discussion about what was involved, the discussions, the 2 years of very hard and very intensive work that people from industry, government and public health and consumer agencies put into this. Just to say that after many adventures in far-off lands, we did settle on a model that basically corresponded with the three groups of the NPSC, but it was quite clear from that dairy was not well treated. Dairy product was not getting the recognition it needed as a very important part of the diet. And with some manipulation, subcategories, particularly for dairy, were created under each of the general categories. In the end, the star rating algorithm, which is the guidance element of the device, awards, as the NPSC awards baseline points for the key nutrients, the nutrients that public health people are worried about overconsumption of. Modifying points that would compete against those around protein, fibre, fruit, nut, vegetable, legume. And because the NPSC scheme is a sort of bifurcate, you're either in or you're out, and what we were looking at is a graduated response across various categories. There were some modifications that went on with the algorithm. In the end, the nutrients were measured on a per 100 gram basis, and the healthy star rating, it's a dyslexic HRS there, scores from half a point to 5 points in half-star increments. The informative element was looking at the information, specific information about those nutrients of public health concern, as well as a positive nutrient, as well as energy. So in the categories generally, in the beverages, we've got all the beverages, so Cokes, juices, that sort of thing, other than dairy beverages. And then there are dairy beverages, which are fairly self-explanatory. They're sort of milk-based and milk analogues. In the core food area, you have all of the foods, including breakfast cereals and such like. And in core dairy, you've got sort of the, if I can call them, the lower calcium cheeses. So you've got yogurts, ricotta cheese, and so on. And then in the category 3, you've got fats and oils, and you've got cheeses and processed cheeses as their equivalent. These have a particular meaning under standard 2.5.4. with having greater than 320 milligrams of calcium per 100 grams. If I'd had my time again, I'd have probably shown you what the device looked like, what the graphic looked like now, but I didn't do that. Instead of that, I'll run through where the foods fit on that scale. I don't think I have a pointer on here. No. I don't see how it works. Well, I'll just point out that the red is the non-dairy beverages and the blue are the dairy beverages. Down at the lower end of the star rating system, you have, getting 1 star, you'd have the sugar-based colas, sugar-based fizzy pops. At 2 stars, you get the diet colas. Half a star, right at the bottom, you get things like the orange drinks that you dilute that are very highly sugared. At the top end, in the red, in the non-dairy beverages, you've got at the top skim milk. Full-fat milk gets 4 stars. Interestingly, you can find iced coffee that's got sugar added that gets 2.5 stars. You can also get iced coffee with skim milk with no added sugar that gets 5 stars. 5 stars is also available for whole orange juice, and there's been some criticism of that because the tendency for, if this is going to get 5 stars, people think that you're going to encourage overconsumption. But when you think about what this system is doing, it's measuring various independent nutrients, and if you overlay volume consumption on top of that, you'll end up with an impossibly complicated system that wouldn't be meaningful. So we're going to rely on serve size, portion control size, and social marketing education for those foods that are very healthy innately, according to the profiling system, but that which we want to avoid overconsumption of because of inherent sugars and so on. Next one. These are just the general foods with the cheeses, the core dairy foods at the bottom graph. Just looking at breakfast cereals, down at half a star, you've got some puffed rice products. You've got Wheat Bix at 4.5, a bran cereal at 5. You've got corn-based flakes. I have to call them that because corn flakes apparently identify as products. But corn-based flakes from one manufacturer get 2 stars and from another manufacturer get 3 stars. So there is variation from product to product. Amongst the yogurts at the bottom there, the yogurts and other cheeses, you've got natural low-fat yogurt gets 5 stars, and a 98% fat-free yogurt gets 2 stars, which tells you something about the sugar that's being added there. And one of the reasons that you do need this sort of system is to cut through some of the marketing hype that would indicate a food is healthy when perhaps it might not be as healthy as you think. Strawberry low-fat yogurt gets 4, blueberry yogurt, which is not low-fat, gets 3. Greek yogurt, which tastes the best, gets 1.5. And you've got to realise this, that fat and salt and sugar and so on are flavour, so there is a natural desire for people to go to those products that have got higher fat, higher salt, higher sugar. Having this sort of information available for them, we think, will give them something else to think about when they're buying their foods. Category 3, these are the cheeses, and there's been some controversy about this, cheeses and the fats and oils. So the cheeses are in the blue and the fats and oils in the red. We've got an extra light spread, which is probably about 70% water, which gets 5 stars. Salted butter gets half a star, unsalted butter gets 1 star. Olive oil gets 3, canola gets 4. If we go to cheeses, those that get 5 stars are the 50% and more less fat cheeses. There's a creamy camembert that gets 4.5, and there's a double cream camembert that gets half. There's cheddar cheeses that, a generic name, some cheddar cheeses get 1.5. There's other cheddar cheeses that get 4. There's a brie that gets 3. So there's really a very good spread of cheeses from along the continuum. So it does give people an opportunity to see, how much they're willing to trade off for flavour, for how much they're willing to trade off for healthiness, if I can call it that. Now I'll go to the device, which I should have probably done first. This is the system that ministers agreed in June last year. Don't take too much notice of the design itself, it's the elements that are important. First of all, the health star rating element, which consists of the stars, 5 stars, graded in half a star increments. No food gets no stars. That's different to the Institute of Medicine version in the USA, which has a 3-star system, but it has no stars. If you don't have enough, if you've got poor enough nutrient levels, then you don't get any stars, so you don't actually get a label. That, we think, is a bit more confusing. So even salted butter, lard and what have you will get half a star. The logo is part of it, the health star rating. It's all been consumer tested, and these were found to be the key elements. The slider was very popular. Some sort of numerical value that supported the shading of the stars to make it crystal clear to people. Some people more numerate and some people more graphic. So that's the informative, the guidance element, the interpretive element. Then underneath are the various icons, 3 of the public health concern nutrients, a positive nutrient, because all foods generally have something in them that are good, and industry would appreciate the idea of being able to demonstrate what that is on the front of the pack, easily visible, and energy. I won't need to bother to go into the fine details of it. There is a hierarchy of how the label is intended to be applied. At the top is the full star rating system with the informative elements as well, all 4 icons plus the energy, etc. If the space doesn't permit that, or if industry chooses not to have a positive nutrient listed, there is a ability to have something smaller. Lower still is just the stars and the energy icon, and below that again just the stars, or even on occasions just the energy icon. That would be particularly useful, for example, where just because of label size and package size the stars would be ineligible. Thank you. Unlegible.
Possibly illegible.
Unlegible.
Yep.
Not visible. Thank you. I'll learn to speak Australian at some point. Okay, that's where we're at. I won't bother with this too much. Just to say that FoPL exists, and it is intended to do those things that are identified there. We're working on it. We've met once so far, so that's exciting. Gaps. The big gap to deal with that we've been charged with dealing with is how to deal with anomalies. For a start, are there anomalies? Or is it just that some manufacturers don't get enough stars, or some public health people think some products get too many stars? So we've got to determine a system like that, and we've made significant headway on that at the first meeting. How to deal with volumes and portion size. That's something important for industry to pick up. The Beverages Council has come up with portion sizes, and they're perfectly agreeable. 600 mils and less is a single serve. If it's in a pack larger than that, then it is a 250 mils is the serve. This is important for labelling purposes, because previously, in years gone by, cans of cola were labelled as two serves, and you get lower numbers down there. So it's quite a concession for industry to come up with a minimum package size of, or maximum package size representing a single serve of 600 mils. The social marketing and consumer awareness and education is really important, and government has got to come to the party on this, and it already has across the country allocated a large amount of money for that. And that will be rolling out as the products roll out. Opportunities. Well, given that the opportunity for consumers is to have information that cuts through some of the marketing spin and gives them real, meaningful information based on the nutrient elements about how much fat, how much salt, how much sugar, the energy density of the food, balanced against the useful nutrients such as fibre, fruit, vegetable, nut and legume, and so on, is going to be really important. That's a wonderful opportunity for the consumer. The rest of the opportunities are all about industry. Marketing, it's a voluntary system. And there are massive opportunities for marketing, because if your food is healthy, you will get a star rating system on it, a highly credible government-sanctioned label on it, which can demonstrate and will be accepted and trusted by the consumer to indicate that your product actually is healthy. If it isn't a healthy product, stop telling people it is. The other issues are opportunities for industry to reformulate. You can reformulate between products by dropping salt, dropping fat, increasing fibre, etc. And there is a hierarchy, so enabling people, industry, to vary the design within the overall guideline so that they can use the most appropriate label on their packages. And that's it. Thank you.